And we are live. Dr. Sally, whenever you are ready.
Great, thank you very much. So welcome everyone. We will wait just a couple of minutes to ensure that our whole audience has been able to join. Thank you. So please give us a minute. Okay, Sabina, Anubhav, shall we start?
Please do. Thank you.
Great.
People start coming in and out.
Brilliant. Thank you so much. And welcome, colleagues. Welcome to our exciting panel on the role of social science in pandemic response, forgetfulness, invisibility, and uncomfortable truths. And this is our opportunity to reflect, learn, exchange with each other on the critical role of social science in pandemic responses, and in particular, looking in at the case study of COVID-19. So we have an amazing panel from different perspectives, positionalities, geographies, and learnings on social science. And I'm going to introduce you to them. I'm just going to give you some snippets. They've all got rich, varied, and exciting backgrounds to share with you. And before I do that, I'm just going to explain how the panel will run. So we're going to kick off hearing from each of our panelists. So they're going to share their experiences with you, their thoughts with you on this issue of social science and COVID. And dear audience, what I want you to do is to join with me to pose questions to our panel, so that together we examine with them the role of social science in COVID-19. So please, thank you, Anubhav, please, respected audience and attendees, put your questions under the Q&A section. And if you want to put a question to a specific panelist, that's fine, please do that. But I would particularly welcome questions that go to one or more panelists that help me get the debate and the dialogue going. This isn't a PowerPoint panel, this is a dialogue and discussion panel. And the more we can learn together, the better. So very much looking forward to your questions. And also please do tweet. And Anubhav, if you could please put the handles for Twitter in the chat function, that would be brilliant. We want to get this debate going. We want to share experiences within and beyond the panel. So that's our plan. I hope that sounds good. And I am now going to do my best to introduce our fantastic panel. So we will start with hearing from Dr. Tamara Giles-Vernick, who is the unit head of Anthropology and Ecology of Disease Emergence Unit at the Institut Pasteur in France. She's a medical anthropologist, and she is the coordinator of the SoNAR-Global network, which is a European Commission funded global social science research network on preparedness and response to infectious threats. And we're going to learn from her about that today. Really looking forward to hearing it. She's also got depth of experience working across Central and West Africa, including on COVID-19, zoonotic diseases, Ebola, Buruli ulcer, and HIV. Tamara, can't wait to hear from you. Next up is Dr. Inaya Rakhmani, who's the Director of Asia Research at Universitas Indonesia. She's also honorary member of the Indonesian Young Academy of Sciences. She's been researching around the inclusion and exclusion of social sciences in state responsiveness to multidimensional crises in Southeast Asia, including on COVID-19. She's really interested in marginal knowledge systems and has a passion in making research accessible to diverse audiences. Anaya, can't wait for your inputs. So next up is Prof. Lenore Manderson, who's a Distinguished Professor of Public Health and Medical Anthropology at the School of Public Health, University of Witwatersrand in South Africa. She has her feet and presence in many places, also honorary professor at the Institute at Brown for Environment and Society in the USA, at Khon Kaen University in Thailand. And she has recently co-edited with Nancy Burke and Io Wahlberg a brilliant, free, inspiring collection, a book on anthropologies of urgency in the time of COVID-19. And Lenore, looking forward to learning more about that in the panel. And Lenore has been a great supporter and mentor to social scientists all over the world working in global health, including myself. So thank you, Lenore, for that. Next up, we have Joseph Kimani, who is from Slum Dwellers International in Nairobi, Kenya. He has a really exciting and impactful background in community development, human rights, and is a governance practitioner, 16 years experience in the human rights sector, training community rights defenders. He's currently program manager at Slum Dwellers International in Kenya, and he oversees the implementation of projects and programs at the community level, including in Arise, which is a GCRF hub focusing on health, well-being and accountability in informal settlements. And I've learned so much from Kimani on participation, social science and community-led participatory processes for change. Kimani, really looking forward to your inputs. Then, last but not least, Dr. Rosalind Skitiano Samayano, who we can also call Leah. Apologies for my pronunciation. So Leah is the Associate Professor at the Institute for Population and Social Research at Mahidol University in Thailand. And she founded and directed the Foundation for Southeast Asian Studies and was previously Asia's Regional Director for IDRC and is founder, regional director for the Rockefeller Foundation in Bangkok. So like many others, wearing multiple hats and has multiple experience to bring here. And just also to announce, so Joseph Kimani is also currently Executive Director for SDI in Kenya. Thank you very much. I'm sure you will agree with me, what an amazing panel. So, as I explained, what we're going to do is hear from each of them. They're going to give us an overview, a provocation, a summary of their thoughts and their learning about social science in COVID-19. And then we're opening up for questions, for dialogue, for getting the discussion going across and between the panel. So, dear audience, please help me. Please use the question and answer function to put in your questions, your thoughts, your comments, and really look forward to hearing from you. So I will then pose those questions to our panel. Okay, so let's go. So Tamara, over to you. Please share your thoughts with us. Thank you.
Okay. Thank you so much, Sally, and I'm delighted to be here. I just want to talk for a couple of minutes about the SoNAR-Global partners' conduct of a qualitative vulnerability assessment that we led in 5 European countries, as well as with our partners, the Brock School of Public Health in Bangladesh. And what this approach did was actually brought in through a qualitative tool some 800 extremely rich interviews. This is an on-the-ground, again, qualitative tool that was developed by our partners at UCL and adapted to address the consequences of COVID-19, really building from the ground up locally meaningful definitions of vulnerability and identifying these kind of cross-cutting factors that may shape the kinds of marginalization and exclusions, but also reinforce capacities to cope in the face of COVID-19. And as part of that, we work very closely in these 5 European countries, that is France, Germany, Italy, Malta, and Slovenia. We work with certain stakeholders and beneficiaries to develop policy responses to the findings. And I think what this approach does is it really shows how the qualitative social sciences can produce actionable evidence and analysis and help to work with stakeholders to affect policy changes. Now, clearly, Brock has a lot of experience in this domain, but I just want to speak to a couple of the themes of the roundtable. First of all, about forgetfulness. I think historical amnesia has been a kind of recurrent pattern across the different sites in which we've conducted this assessment, but I think our vulnerability assessment results really try to reverse that in showing how historical relations between the public, between certain social or occupational groups and state institutions, medical professionals, media, diverse organizations, that it's really crucial to understand the kind of cumulative, longer-term erosion of trust and processes of vulnerabilization that began well before this pandemic, but in effect were exacerbated by it. I think another sort of forgetfulness that's coming to play is, again, as I said, for instance, Brock School of Public Health has a really deep and rich experience with community engagement. And I think one of the things that tends to be forgotten in Europe is this kind of south-north exchange, that we have a lot to learn from those of you with a really deep experience in different kinds of multi-sectoral community engagement. As far as invisibility goes, and I'll try to move very quickly because I know that there are other people, I think there's a kind of historical, this historical amnesia is really linked to a process of invisibilization. It's not just a condition, but a process. There are policies of invisibilization that we found that constitute, in effect, a profound barrier to access to assistance. Formal and legal definitions, for instance, of who is vulnerable, of what is essential or not essential work. These kinds of definitions can obscure the visibility of new categories of people who have been marginalized or excluded over these pandemic processes, and can even, we found, become a way that people might self-police their access to assistance in saying, for instance, I don't have the right to ask for help when I actually need it, because of the ways in which legal or formal definitions of vulnerability are promulgated. And finally, just to finish with two sort of uncomfortable truths. First of all, one of the things that we found across particularly the European findings, is that institutions that were designed to assist certain populations actually exacerbated vulnerabilities and suffering during the pandemic, affecting short and long-term health and well-being. And then finally, more broadly, I think that there's maybe a two-sided uncomfortable truth, both for social scientists and for public health policymakers who rely on kind of quantitative approaches to answer social questions. For those policymakers, the point is that unlike quantitative research, the kind of ethnographic work that we and others have been doing can really shed light on how and why individuals or certain social groups find themselves marginalized or excluded. So it's not just the numbers, it's how it happens that we can contribute. The second point, I think, is for those of us who are qualitative social scientists, the uncomfortable truth is that we're always going to be dealing with and are in fact continually fielding questions about the representativity of our samples and our findings. And I think that that's something, I just want to throw that out there. It's something that we have to manage. I'll stop there.
Wow, Tamara, brilliant start to the panel. Thank you so much for those thoughts. Really exciting, really thought-provoking in terms of the power and potential of ethnographic, of qualitative research in unpacking and in uncovering the vulnerabilities and how they play out. Some of the challenges that we can be pushed towards social science, and also the power of learning across different contexts. And completely agree with you as someone sitting in the North about how much we have to learn from community engagement, from trust, from responsiveness of health systems in LMICs and beyond. So thank you, Tamara. So audience, dear audience, remember, we're in this together in terms of getting this dialogue going across the panel. So please put your questions forward, your comments, your responses, your reflections, and lesson learning. So next up, please can I welcome Dr. Inaya Rakhmani. Welcome, Anaya.
Thank you, Sally. Happy to be here. Should I begin or?
Please,
okay.
Go ahead.
Thank you so much. What Tamara mentioned really resonates with my self-personality, the kind of academic work that I do, and the academic alliances with CSOs and some reformist government actors in Indonesia and the region. And it really is actually the focus of what I would like to mention today. As a bit of a context, I'm speaking here based on the insights that we've gained in a study that the Asia Research Center at Universitas Indonesia jointly organized with the Global Development Network with the support of the Lodge for Democracy Myanmar Initiative at the International Development Research Center, IDRC, Canada. And while the support is not expansive, but because each of the researchers, among them is Rosalia Sciortino, is with us today here, the researchers, the academics that are part of the study is also a keen observer and practitioner of responses in the pandemic, whether they're allying with CSOs, communities on the ground, or some sections of the government. So when we write the report and when we research and do literature review, we don't see ourselves as part, as not part of the overall structure that either enables or hinders the kinds of voices that Tamara mentioned as those needing to be listened to in a more ethnographic way. Across these research and country notes, we found that we have a shared concern over the kind of generalizable modeling, epidemiology, life sciences, medicine, and large funding not only goes into equipments for health security, but also the kind of research, rapid response research and policy research that largely ignores the voices of communities and those who are part of minority groups. And the elements of minority emerges in different ways in not only different countries, but also different levels of administration, whether in the central government, local government, federal government, state government, etc., down to a village level and down to a neighborhood level. In some countries, in the case of Indonesia, we can see neighborhood lockdowns that are moving faster than government lockdowns and quarantines. And this is a model that also emerged in the Philippines, where there are socialist pantries opening up, giving food and warm meals for people on a neighborhood level. And we think that social researchers must see themselves as part of the kinds of social inequalities that marginalize voices from policy responses, and at the same time, by employing certain types of methodologies, by privileging certain types of methodologies that receive larger funding, we are also choosing to not facilitate minority groups who must be approached with qualitative and more in-depth and long-term research and understanding. One cannot see as a social scientist to not be part of the subjects of our research. This kind of deep engagement, I think, is one way to curb or overcome the kind of inequalities within our funding system, because the kind of academic collaboration with exact sciences, engineering, biomedicine that is being largely funded by not only our respective states, but also from our international donor counterparts, largely form a kind of cluster of research that puts social sciences and social scientists as embedded in a research group, but not necessarily being able to use those research tools to make sure that the necessary voices are being heard. Only by acknowledging that these instruments are being reproduced in the workplace that we are part of, that we can actually minimize the inequalities that hinder marginal communities' peripheral knowledge that are actually in some ways more sustainable than our modern sciences and modern and rational knowledge. I would like to end the short talk here with calling out for those from all over the world, not only from the so-called global South or global North, but also from those privileged and those marginalized within between sciences, within and between sectors, who share the same concern of engaging in long-term community research so that social sciences can actually increase the everyday life quality of people facing upcoming crises. If there's one thing the pandemic has taught us, actually the informal resilience that is practiced by ordinary people can in some contexts be much more responsive to multidimensional crises than state centralistic policy responses that so far benefits generalizable models. So I fully agree with Tamara, what Tamara mentioned, and I'll return the floor to you, Sally. Thank you.
Thank you so much, Anaya. Dear audience, I told you we had a brilliant, engaging panel. So yet another really exciting set of thoughts and inputs. And thanks very much, Anaya, for encouraging, challenging all of us to have a critical reflexive lens on our own positionalities and what they mean for privileging different voices, what they mean for excluding marginalized voices, and to think about the methods that we use, the sectors that we work within, and the disciplines that we link to, and focusing in also on that informal resilience, that context embedded strategies we're seeing and how we can learn from those. Thank you so much, Anaya. So Lenore, next up, please share your thoughts with us.
Thank you. It's wonderful to follow on and build on what Leah and Inaya have been, Tamara and Inaya have been talking about. I want to draw on some of the work that I did in editing with colleagues Viral Loads, which I've just put the URL in the chat box for anyone who wants to read it, which brings together the experiences of researchers around the world. And I'll come back to what we were doing to that in a second. But I also want to draw on my work leading a social science team, doing policy work across Africa with particularly with people from 8 countries, providing detailed input on vulnerability and human rights. And then I'm now leading a chapter in the second COVID report for the South African government on vulnerability again, where we're bringing together multiple teams to pick at why COVID has had such drastic impact on a select group of people. And that's the group that is consistently forgotten, ignored, and then after the fact rediscovered. When we decided to edit Viral Loads, it was April 2020. And originally the press said it wouldn't even be very interesting, and why would one want to write something about a pandemic that had only just been declared? And of course, my reaction was, trust me, this will be big. I certainly didn't anticipate that it would be as dramatic as it has been, accepting that HIV already proved the point. And what people were saying in March and April in 2020 was pretty well what people were saying in the early to mid 1980s about HIV. And we seem to have lost a memory about a response. And one of the things that incensed me was every time someone said the last pandemic was the Spanish flu in 1918 to 1919, it was like, excuse me, where have you been? So we have that experience. We have the experience of SARS and the decision by WHO for pandemic preparedness being built into every country's health system, work throughout Africa in 2008-9 in response to the H1N1 pandemic. Then we had Ebola, and for some reason no one had remembered what had even been done for H1N1. So there were new lessons that were being learned, which were lessons that had already been established before. And then Zika welcomed a whole lot of new people commissioning research that had already been undertaken for other purposes. And it seemed to me in doing Viral Loads and then thinking about vulnerability for the Pan-African and now the South African program, that we had vast knowledge of what would happen with the pandemic, and we would be able to write around it with considerable authority without having to be collecting new research with vulnerable communities. And what we anticipated is exactly what has come to play and continues to be the case. And the first of those lessons is the way in which any disease exploits pre-existing vulnerabilities. So if you define a vulnerability either in terms of social structural vulnerability, and that includes nationality, status, and employment, and education, and age, gender, race, and so on, but also infrastructural vulnerabilities. If you live in a degraded area or of extremely poor area, as much of the world does, then those vulnerabilities are going to predispose people for infection. Vulnerabilities amplify the effects of infection, and the infection amplifies the effects of vulnerability. Infections leach people's capacity to continue to cope, and you get a downward spiraling with a group primarily, or especially with groups of people who are invisible. And I think it's Tamara who spoke of invisibilization, of groups who are rendered invisible by states. And so what we saw around the world, as diversely as, for example, from India and Malaysia Australia, Turkey, South Africa, were states harnessing mechanisms to support people who could become vulnerable, but not to address the problems of people who were already vulnerable, who were already living state failure. States harnessing technologies that in fact exacerbated relations of power and relations of powerlessness. The state response exposed prior tensions and divisions, and these sharpened in crisis. And I think for me, one of the most telling acknowledgements but non-action of that is that in South Africa, we have a social unrest index, and that maps when there are community road blockages, riots, looting of shops and so on. And they have spiked intermittently through the pandemic as increasingly the poorest of the poor have become even poorer. Hunger has increased across the country, and those who were always poor have been carrying that burden. And you get these little explosions, but the fact that it's being monitored itself says a lot about both understanding that and not acting on it. And that is the real tension, the willingness to act upon it. The other lesson we have is that measures taken to contain infection expand and amplify the effects of those vulnerabilities. And that speaks back to how vulnerability anticipates and provides the preconditions for infection. I think one of the things that really struck us in putting together the book was both being able to bring that together with such speed, so that the book that was with the contract signed in August we had, and it's a 250-page book, 250,000 words, not 250 pages. It's about 400,000 words, 400 pages. We already had that with the press in January 2021. People had the material there, and we were already well aware of those kind of trends, and we've seen them revisited, rehearsed and rehashed with every pandemic and epidemic over the last few decades. And we're currently, of course, looking ahead, and people are increasingly saying COVID-19 is a rehearsal for the antimicrobial resistance crises that will come about within the next decade or so, and the impacts of global warming. And I think the COVID provides us with a unique opportunity to insist that social science understandings of these issues begin to be more extensively taken into account from the beginning of any health crisis, rather than to be brought in at the end. So I'll leave it there for the moment, and we can pick this up later.
Thank you so much, Lenore. Also fantastic and inspiring, and congratulations on Viral Loads and getting that out free, accessible in such a short time period. And Lenore has put the link to Viral Loads in the chat. Leah has put a link to what she'll be talking to in the chat, as has Inaya, about how to mobilize social science during a pandemic. So please look at those resources. And Lenore, thanks also for picking up on these issues that are in the title of this panel, right? And building and linking to what we heard from Tamara about forgetfulness, around knowledge that is lost or conveniently forgotten, around processes of invisibilization and what they mean, and also around the process of infectious diseases such as COVID and how they work to amplify existing intersecting inequities in complex ways. And I think Viral Loads depicts that in a very powerful way, together with narratives of change and support and solidarity. Great. So Dear audience, if you've just joined, I did introduce all of our brilliant panel when we started, but the bios are up on the website. And what we're doing is we're hearing from each of the panelists, and then we're opening up into dialogue and exchange. And I'm looking forward to comments. It's great to see the questions coming through. Please keep adding. So next up, Joseph Kimani. Welcome, Kimani.
Thanks, Dr. Sally. Indeed humbled to be amongst this panel of brilliant minds, people who've really been following their works and really inspired by the kind of work they do. So we are really humbled to be invited here by the organizers. In relation to the topic, we wanted to share our experience during the COVID period, and more the role of our community core researchers and community organizations and how they responded to the issue of COVID. The pandemic came and there was panic from the government, panic from institutions. All of us were demobilized, all of us were locked in our homes, and all of us needed information. But who was willing to go to the ground for this information? And this presented to us a very critical, important role of our core researchers, people who are normally forgotten, normally playing a role of just assisting in collection of data, but this time becoming the primary information givers. And this was really how we experienced the importance of really placing our attention to the communities and the work they do. And the experience we had was very easy, how it presented itself. The government, of course, their response was to constitute a committee, and the committee was waiting to design solutions to the informal settlements in response to COVID, identifying who are the most vulnerable, identifying where the issues need to be addressed, but no one had that information. So what the Federation of Slum Dwellers under the consortium of Arise Hub and a movement of collection of CSOs within the informal settlements came together and started supporting the networks, the groups, the core researchers at the community level using a mobile phone. And I developed an app that monitored the happenings every week, and the updates were coming every week, weekly, and this information was channeled now to the government committee. And it became critical because the information was used now to identify which areas needed what response. And it's important to say that actually there was no response from the government in the initial couple of months. All the responses that were coming were just from the groups themselves, mobilizing each other, pooling their resources. Yeah, and these are communities that have been basically relying on informal work, and now they are locked, they have no resources, they have no access to food, to health. So all these problems were later on being solved because the information that was coming out of the community was critical and was used to do that. So the committees got this information. There was a challenge of mapping where the isolation centers will be placed. The groups were able to map that, what is, and we are talking about the capacity that communities have of collecting their own data. For us, within the Slum Dwellers International, these are practices we've really promoted, the understanding that if communities were given their own opportunity, they will present their issues better, and they will have better solutions as compared to people designing them from their boardrooms or elsewhere, or any lab for that matter. So, so that's what we thought we share here, that it's important to put our focus more so on community-led initiatives, community-led data collection. And remember, when communities collect data, they don't isolate themselves. They become activists in the process. And this has been something that we've also experienced. We see community activists emerging out of the issues because they are touched. And as well as collecting data, they also collect each other. So they create a movement of people who feel the issues that they are collecting. So these issues become embedded within themselves, and they become part of the people moving the agenda in a better way. So probably at that, and waiting to hear questions from you. Yes, thank you.
Thank you so much, Kimani, for those really important and inspiring insights around the power of community-led data collection processes and initiatives, and what they can bring in terms of demanding accountability, looking at options for change, supporting ways forward, and as you say, people coming together, building a movement for change in response to data, in response to issues that have been identified through that ongoing dialogue and community-led processes. Thank you so much. So last but not least on our panel, Leah, over to you. Please share your initial thoughts with us. Thank you.
You're on mute, Leah.
Sorry, I always do this. Okay, so I start again. Thank you to Brack and Sabina for inviting me in this panel, and thank you again to Inaya for involving in the project. And what I will be saying now very quickly is indeed based on the article I shared in the charts and also the research project conducted with Inaya. And I will just say briefly, and this is my main statement, that not involving social scientists is at our own risk and peril. We are doing things messily, and part of this mess is, in my view, also because social scientists have been poorly involved, at the least in Southeast Asia. And now I will briefly say why is the case. Let's start from the virus itself. We are talking about zoonotic disease. There is a lot of talk about One Health, but often this is narrowly interpreted as just medical and veterinarian science, forgetting the whole economic, political dimension of the virus and how it contributes to its spreading as well as its start. We should not forget that probably one theory, it is about the market and the wild animal trade, but there are many other dimensions that we can discuss relation to that. The decision in this pandemic we have seen have been often political and economic rather than based on epidemiological data. Many lockdowns have been closed, opened without any clear understanding of the pandemic, although of course the pandemic was mentioned as the rationale for such opening and closing. So we need to understand the political context, we need to understand the economic context. We cannot just have a narrow understand of pandemic as the decision making or the main decision for important policy decision. We also have to challenge the abuses that have been made in the name of medical public safety. I think this is a very medical determinist discourse, meaning that everything can be done as long as it keeps the public safe. And we have seen in this region a real strengthening of violation of human rights, as well as the look of the pandemic as only a security issue, as given permission even for a president in a country in the region to say that people that don't comply can be shot at, can be killed. So that is where you need critical social scientists to expose such narrow medical determinist view. Very basic, but often forgotten, COVID-19 is a behavioral disease, so of course it depends on behavioral change, but not only this, on the context that makes those change possible. So it's easy to say, wash your hand, have good ventilation, but doing nothing, as we have seen many governments, doing nothing about providing the condition, improving the living condition, for instance, of migrants in Singapore or Thailand, very crowded living condition. They are keeping the migrants inside. They are not improving their living condition. They are not given bed and praise when there are no crowded conditions. So again, Here, when we talk about outbreaks, when we talk about cluster, we need to understand the way people live. Again, social scientists are essential. Statistical literacy, we have a lot of number going around, but then do we understand this number, the way they are presented, what they mean, what are the people beyond the numbers, etc. Again, something that social science is essential too. There are many other things that have already been said about inequity, about the importance to keep into account class. It's a word that often we like to forget about class and liberal market economy, but class is key. And some people have gotten very rich in this pandemic. There is just a report coming out from Oxfam about this that shows how people that have invested in technology related to the pandemic have made more and more billion and billion, while people are falling into poverty on the other end of the threat spectrum. The last final point, I have two more very quickly. One, we should not forget is about life, death, ritual. People have been prevented from being with their family, what it means when they were in the hospital or when they were buried, what it means, what is this going to, the impact is going to be in the future for the family members of this person, for the way we all have lived with fears and we continue to live with fears. We don't talk much about this. It's as if it's assumed, it's something very normal, but it's not normal, and we need to understand what is happening to us because we'll have very long-term consequences. Finally, if we talk about rebuilding the future, we cannot just continue with the same status quo as we are doing now. We need to think about transformative action, and to think about transformative action is to take into account what all my previous panelists have been talking about, and we need to challenge the current power in place. And here I think we're critical, and I say critical social scientists, so not social scientists, but those who want to challenge the status quo are extremely needed. Thank you very much.
Thank you so much, Leah. Another brilliant set of thoughts are really hammering home the importance of understanding and unpacking context, about context specificity, around the challenges and exclusions of biomedical, medical security-led agendas and the implications of those. Thinking critically about the impact on changes in life, death, ritual. And what I've heard from everyone is around the real power and potential and impact of social science in COVID-19 response in different ways, the importance of that, and the need for social science that isn't done to gather dust on library shelves or within our computers, but is about feeding into potential for transformation, for social justice. Those have been common threads for me. So, dear audience, just to remind you that our fantastic panelists have been putting links to the different resources that they've been referring to in the comments. So thank you to Kimani and to Tamara, who have just done that, and the other colleagues had done that earlier. So I'm really pleased, audience, that you've taken up my challenge of questions. So we have lots. So my job now is to try to summarize them. So I've got them summarized so far into 6 key areas. The first is around ethics and safeguarding. The second is around community engagement. The third is around conceptualizations of vulnerability and policy responses. The fourth is around why is there some hesitancy for social science in some contexts, and how do we deal with this issue that can be bandied about and thrown at social scientists around generalizability. The 5th is on the role of the state and critical lenses there. And the 6th so far is around vaccine hesitancy. There will be more. And what I'm going to do is just pose them to you one after the other, and we'll see how far we get. Okay, so please keep adding. Colleagues, please keep adding questions, because even if we can't get to them all, we will find a way to share and reflect and keep the conversation going. Please remember to tweet as well. So let's start off with these questions that link to ethics and safeguarding, and they come from Sassy Molyneux, Rachel Tolhurst and Shireen Chowdhury. So Sassy says, in Kenya, we face dilemmas in organising face-to-face interviews with the most vulnerable households early on in the COVID-19 pandemic. Risks and concerns for research staff and families. I'm worried about the depth and value of phone-based interviews, even where we had previous relationships with those families. Rachel says, I'd be interested to hear reflections from panelists on balancing depth of insight, ethics, and safeguarding, and the need for rapid research that is quickly actionable in crisis. And linked to that, Shireen says, how can we as researchers ensure inclusion and engagement to often invisible groups in an accessible way for in-depth and meaningful data? Marginalized groups are referred to as hard to reach groups, but perhaps it is services or research methods that can be out of reach. And these are the challenges exacerbated by COVID. So thoughts, reflections, and questions around ethics, around safeguarding, and around whose voices are included and excluded in rapid research. Who'd like to kick off, panel?
Joseph.
Sally,
Please.
Yes, there is this question that keep in a way haunting us. We who do community-led data and organize this community to collect their own information. The question of credibility, the question of safeguards, the question of ethics, the question of protocols, quite heavy. When we consider information as only important when it qualifies to certain parameters, then there is a problem, because for community, what is important is it's a method or a way of conveying their issues and problems out there for someone to help intervene. That is critical. How you measure what volume of information will convince the government that there's a problem in a community, we'll leave that to science. But for the community, what is critical is that, for instance, during COVID, there were people who were hungry. What kind of quality information did we need to qualify that a lot of people have been living from hand to mouth and they had been dislodged from their daily labor and lacked food? What kind of information was critical? Was it important for community members to say, we've gone door to door, we've looked at our neighbors, and we've identified who does not have food? Is that information important at that point? For us, it is. If the community says they've collected, they've walked, they've gone door to door and figured out that there are people who cannot access medicine, and this is information the government rely on every day from community health workers, from paralegals. I mean, these are the structures at the ground, at the community level. So we have an issue, and probably this is where academia can help maybe sort later, this issue of balancing and discrediting information that comes from the community is not valuable unless it passes certain measurements or parameters. So yes, the invention of phone and the use of phone to convey data or information was critical because all of us were locked at our homes, and the only way of even the government passing the information other than radio was to rely on groups, WhatsApp groups. Yeah, so they were created. Communities opened WhatsApp groups, and they used the WhatsApp platforms to share who, and in fact, they would even take photos and show yeah, who is affected. They would even take short videos and give voices to the people who are affected to talk. So all this was information that was available. It wasn't just text out of context, but actually real information, real time. Sometimes they will even place on Facebook live information, live happenings of police killings, of anything that was happening regarding their safety. So yeah, so just to put a challenge out there for practitioners like us, community-led data and information need to be put in context. There's a time of crisis. What kind of information is sufficient to say we have information? Thank you so much.
Thank you so much, Kimani. So really highlighting that we are talking about a time of crisis, right? And people are hungry, people are facing multiple challenges, and the key role of community responses there. And just also to note that Rachel Tolhurst has put in some links in the chat around learning, if you want to read more about data collection and communication from Federation of Slum Dwellers in Kenya that Kimani's talking about, and the role of youth as well in that process. So Lenore, Tamara, please come in.
Thank you. I want to build on that because while I think it is valuable to be collecting new data for the community, the point is that we do have that data already, and it shouldn't have been a surprise to anybody that people who were already desperately poor would be made poorer when they lost their opportunities to work. And part of it then relates to government reluctance to take steps that they are trying to not take under normal circumstances. So to give you an example, in South Africa, right at the beginning of the epidemic, they introduced increases to people on supporting parents grants, single mother grants, grandparent aged care grants, and so on. So they knew that someone who is dependent upon state support would need that money even more, and that the money that was already being provided them was inadequate. Australia did exactly the same thing. But what neither country did was in any way address people who they were already reluctant to take responsibility for, people without papers. Now, whether they're so-called illegal immigrants locked up in hotels in Australia, or whether they're people living in informal settlements in South Africa or in Kenya or in Dhaka or in Delhi or wherever, if they were already outside of what the state defined as its responsibility, they were left to struggle. Now, that also included individuals. So some people in South Africa, there are many people who are not registered and therefore are stateless. And we've got everywhere in the world people who are chronically stateless, 3 generations of people who do not have a passport, a birth certificate or anything else. So they're always under the radar. People whose jobs are informal, in quotes, people who sift through garbage are ignored for the most part. Sex workers are ignored. People who sell drugs, as well as people who are drug dependent, because their behavior is regarded as a criminal offense. So they're always skipping under the radar. And then the responses are firstly to ignore them and then to further criminalize them. So to render the mechanisms even harsher. Now, these are all things that we document all the time. And I think part of the challenge is also to ensure that we have a place at the table where decisions are made. And the groups that have been most active in that, and certainly in South Africa, have been already groups who are speaking for those communities. So, for example, the disabled community organisations have been really outspoken and putting pressure on government. And the challenge there is that the people they speak with in government are also powerless to people higher up in government. So the hierarchies in society are often replicated as hierarchies within government responsibility. So supplementing wages and supporting the economy takes precedence over supporting people who are homeless and hungry.
Thank you, Lenore. Powerful. So Tamara, Leah, Inaya, anything on ethics, safeguarding, technologies, phone interviews, exclusions? Welcome.
Sure. Great responses from both Lenore and Joseph. I just want to add one thing that, just may perhaps add a little bit of nuance to what's been said before. That yes, to a certain extent, many states already have this data on who's out there, who's excluded. But I also think that, first of all, there are certain individuals and certain groups that are so dissociated, that are so disconnected, that it's not even possible to consider them as part of a community. And I think that before we begin these processes of community engagement, I think it's really important, first of all, to try to identify who is excluded. The second point that I think that I want to make is that there are also certain kinds of vulnerabilities, and I know we'll get to the definitions and debates over definitions in just a few minutes, but that are in effect new, that have been produced by this particular pandemic. So for instance, the effects that the pandemic has had both on the health and well-being of healthcare workers in nursing homes, healthcare workers in hospitals, in clinics, even pharmacists. With the massive wave of Omicron, we've seen all kinds of healthcare structures being overwhelmed in France. Students as well, who may get, for instance, an allocation. This is not classically what you would consider a vulnerable group. And yet, we've seen in our own work on the ground that these are people who are sort of, they've been, following courses at a distance. They've been isolated. Some of them have gotten sick. Some of them have experienced enormous impoverishment and, are availing themselves to food banks and the like. So it's also these kinds of groups that I think we need to attend to, and that we don't necessarily have all of the answers at the outset. I just wanted to say something about rapidity. I think that, there are a number of different rapid qualitative evaluations out there. In fact, the WHO Social Sciences Roadmap is actually, we've been doing a review of different kinds of qualitative methods. And I think a lot of it, the capacity to be able to do this kind of work very quickly really depends on the availability of resources. And I don't want to get into something quite so logistic, because I think that there are other issues. But I think that it's a really important consideration, and I'd be really happy to exchange with people offline about what our findings are, and to exchange with them around that.
Thank you, Tamara. Leah, did you want to come in, or can I move us on?
Yes. I wanted to comment quickly two comments. I think, yes, being an anthropologist, I think ethnographic research to me remain the golden standard. So unfortunately, that was not possible unless you do as part of the community. So that, like I think in the case of Joseph, what he has been saying, from within the community themselves, they can do really more ethnographic, kind of ethnographic research of looking at the neighbor, looking what is happening around you, etc. They have the trust of the community. They can get for sure more in-depth information. My experience now with a study on social protection related to COVID-19 in 6 Southeast Asian countries. We had to limit because it happened also to be at the peak of the Delta. So when Southeast Asia from being a low prevalence became a very high prevalence up in the top of the world, and then of course could not, no other way than doing by phone, I think the information is more limited. I think we need to recognize some limitation of this research, but at the same time, like it was said, it is a rapid assessment. So as a rapid assessment, it has certain limitation, and we need to recognize this in the way we work. The final comment is on the hierarchy of knowledge. You know, there is this established hierarchy that quantitative data is better than qualitative data, and no one question. I am amazed, you know, I mean, we all go to our world in data, we all reproduce the chart that are there. We like to put this chart in our study, whether it's excess deaths or number of cases or name it, whatever. Even there is a stringency index to see what kind of policy the country have taken. We trust blindly all this kind of, but we know how data, quantitative data is collected at the local level, especially within a pandemic. We know that many of these data are not reliable because there are political reasons. We know many things. So we know that per se quantitative data are not necessarily more accurate than qualitative data, but still the belief of policymakers, the belief of us as a community of scientists is often more for those days without questioning, why we should question the quantitative data the same way we question qualitative data. And good research is good research in both cases. Or bad research.
Couldn't agree more, Leah. Thank you. Inaya, I know you're really interested in knowledge systems that can be marginalized in different ways. Do you have any comment on the role of phone interviews or different technologies in rapid response to COVID?
Yeah, I was listening with great intent to all speakers because it's really a good feeling to agree with the critical views made here, looking at the issue in different angles. In regards to gathering data during the pandemic with lockdown and distance, as a social scientist, especially one sympathizing with anthropological approaches, because we have our hand on the pulse of our research subjects, and there are people just like us facing crises and needing to adapt to insecure conditions rapidly. Our methods are our tools, our hands and feet that move with conditions. So in some instances, phone interviews can work with GSM basic connection because there's a BTS tower. In other context, text messages could work because for instance, the eastern part of Indonesia, people use free text messaging services as part of the promotion for the data packages. And these are approaches widely used in digital ethnography since late 90s. So I agree with Rosalie when she said that good research is good research and bad research is bad research. It's less about the methods we choose than it is about the people we're trying to listen to. And in such a world where technology permeates to our smallest spaces of our lives, even in rural areas, it's just different considerations with different types of technologies that is operating on that area. And in that, ecological perspectives in which there is a relationship between analog and digital knowledge. For instance, if you want to interview people in the outermost areas in Indonesia and small islands where there's no internet connection, we have a system of, if it's in a river area, there is an ojek sungai, a river taxi driver that we can provide small messages to, and then they return to us with the messages. But these taxi drivers, whether in urban or rural settings, are also local researchers who are also people with their, who are part of different power dynamics and politics, in which we too as researchers, when we recruit local researchers, seeing them as equals, we also can assume that they may lie to us, they may manipulate us, or they can also be a great asset at the end, becoming a stronger researcher than us. And that's the time when we as researchers from the urban area could take a step back and let them take the lead, a stronger lead on the process. So it's very dynamic. And at the center of a good research to me is a redistribution of access and power. Those in the positions of privilege has the responsibility to redistribute that access to as many people as possible in contexts that permit. So methods are tools, to me, including phone interviews and digital platforms. Thank you.
Thank you, Anaya. So colleagues, we have 11 minutes left. So what I'm going to do is cluster another set of questions together, ask for some really quick responses, and then I'm going to ask each of you to close with a final reflection. And please look through those questions to help you think about your final reflection. I'm delighted there's so many. The sad thing is we can't get to them all. So have a look through. The questions I'm going to pose now are around a theme around vulnerability and stigma and community engagement, which come from Kausar Afsana, from Sushil Baral, Kim Azano, Matthew George, and others. So Tamara, in your response to the earlier question, you talked about COVID exacerbating existing inequities, but also producing new vulnerabilities. And there's a set of questions around how do we better understand that? How do we address the role of stigma and how that plays out in complex ways? How can we as social scientists support processes that nurture trust or build trust or understand and unpack trust? And then this, to me, also links to these questions around community engagement and engagement with diverse, vulnerable populations that are marginalized in complex ways in different contexts from Sushil. So any reflections on vulnerabilities, stigma, trust, and engagement? Who'd like to kick off?
I can start if you like. Okay, so I think I noted a number of questions in the chat that, well, wait a minute, how are we defining vulnerabilities? Is vulnerability the same as poverty? Not necessarily. I think we need to expand and really understand vulnerabilities, that there are different kinds. There are health vulnerabilities. There are social vulnerabilities of isolation, economic. That one of our partners in Malta raised the possibility of moral vulnerabilities in which, for instance, people are divided, morally divided as to whether they should adhere to certain kinds of pandemic restrictions or, take care of their aging parents, but at the same time exposing them to the risk of ill health. So I think that we need to see these very broadly. I think we also need to build up, in a kind of deeply ethnographic way, how do our people that we're engaging with understand their own fragilities? How do they characterize those? And can we see common threads across them or a variety of differences? So I think since we have so little time, I don't want to talk too long. I'm happy to just stop there and we can move on to somebody else.
Thank you. Who is that someone else we're moving on to? Welcome, amazing panelists. Lenore.
Yeah, I can say, Dr. Sally, how challenging it was for us during the pandemic when organizations with good intent to respond started asking for a list of vulnerable people. And it was left like that. And it became a difficult question to the community members themselves. First, we have a settlement where over 80% are below 35 years. They were locked out of school. They were at home. You have the settlement itself considered to be the poor of the poorest among the other settlements. And this is where it was the main focus. It has incidents of fires. Even during the time, there are issues of floods. So while the question was particularly the people who came, like Red Cross and ETC and others, were particularly interested with a particular section of vulnerable group or members of the community members were like, no, the entire community, the entire settlement, we are all vulnerable. And that was difficult for all of us to consume. But how do you question that? When they say we lack, we don't have access to our daily meal that we normally access. For instance, roads were closed. They go to neighboring communities for daily chores and manual labor and casual labor. This was not possible now. So even those that were initially the providers were unable to provide at that point. So they became almost exposed and they couldn't even sustain themselves. So it became a very difficult question. In fact, we've been saying it's a very hard nut to crack, the question of vulnerability. And that's why under the Arise hub, we've been trying to put an argument of enumerating the entire settlement and allowing the community members to look at that information at the household level and be able to present their case at the household level, so that we look at people from where they are at the household level, and then look at the merit or demerit of whatever else we are considering. Yeah, just some few points. Thanks.
Thank you so much, Kimani. And colleagues, we do only have 5 minutes left. So I'm going to move to final summary and give each of you a minute left. Remind you that we're talking about social science and pandemic response, forgetfulness, invisibility, and uncomfortable truths, focusing in on COVID-19. We've had a depth of discussion between the panelists. We've got a crazy amount of questions and comments to think through. We've dealt with only a few of those, and apologies to our dear audience that we haven't been able to get through all of them. But I'm going to ask our panelists to just give us a 1 minute final reflection. And if you do want to pick up on any of those questions that we haven't been able to get to, you are welcome, but you do only have a minute. So I'm going to go in reverse order to how we started. So I'm going to start with Leah.
Well, I confess there are so much to answer. So what I like to comment on the vaccine, I think there is a question related to that. Yes, of course, I think the issue of vaccine distribution across country and within country is a very good example of the inequity that we have been talking about, and it brings together clearly politics, economic interest, and not only health interest. So this is exactly what I am trying to say, that we need to look at this pandemic beyond purely the medical or public health, even if always all kind of medical reasons are given. The vaccine shows very clearly that commercial interests are much higher value than the health of the people. And this is something we need to challenge at all levels. So the vaccine is just the most clear example of what is happening in many contexts. Can be even the mask or can be other. There are many examples of the way commercial interests are driving the response to COVID. And unfortunately, there is no time to discuss in more detail.
Thank you, Leah. Kimani, 1 minute maximum summary, please.
Yes. I think it's just to thank the organizers for really, and my colleagues here in the panel for the wonderful presentation. Really seeing a lot of questions there. Probably we can respond to them at a different channel. But yes, just to invite all of us as a role in community-led data, co-production, is a way that we are also exploring to bring government, communities, academia, and I think that can also help so that all of us then has a space to input. Thank you so much for the organizers for this. Thanks.
Thank you, Kimani. Lenore, welcome.
Yeah, I mean, I'm really struck by that question about trust. And I think that one of the things that the pandemic has done is unsettled an order in really profound ways that had not been unsettled really since the mid-20th century. And that has particularly been disruptive for those with power who are largely middle classes and high income countries. And the countries that are struggling at present are no longer divided between wealthy countries and poor countries. And it's not an economic question. It is a question around how we all live with precarity and what we really need to do to ensure some sense of continuity. So I think that this is a really important existential moment that we will be able to, I hope, look back on in a few years' time and recognize how we've come through it.
Wonderful. Inaya, welcome.
I'm just mindful of the time. I agree with the notes made. I'll try to say this in 20 seconds. Invisibility, meaning that the commercial interest operates and mobilizes us far more effectively than any genuine social bond that we can. We live in a precarious condition in which we are driven to just survive whatever class we are in, because we actually face a common precarious and climate crisis and health crises. So we are actually fundamentally interconnected, and it's made invisible because it's normalized. And I think social sciences should make those invisible and the operations invisible known to non-specialists, the public, and also people from different sciences and traditions. Thank you so much for the organizers. Thank you, Sally, too.
Brilliant. Thank you, Anaya. Tamara.
I don't have very much to add to the brilliant comments that my colleagues added here. I think that there's just to say that I think that, you know, I would agree with everyone here that there's this incredibly important role that the social sciences have to pandemic response. And we've seen, I think, a lot of movement, you know, on the part of state organizations and the part of, you know, WHO and others to include and to integrate the social sciences, but we still have a long way to go, I think, in making the arguments about the usefulness, and particularly in grappling with some of the points that, for instance, Leah brought up about, you know, the hierarchies of knowledge, the value of qualitative work, the importance that it has in explaining how, why, and, you know, these really rich insights that we can develop. And with some of that, I think that it's possible that partnerships with other kinds of researchers, you know, as many of us are involved in, are really important for really pushing that forward and making sure that the social sciences are heard and really taken to heart. So I'll leave it at that, but thank you very much. And thank you for a brilliant job, Sally.
Thank you, amazing panel. Thank you, audience. I'm sorry we've gone 2 minutes over. We've heard about the power and potential of social science, how social science has been used to support transformation within communities, to address knowledge hierarchies that we see in health and beyond, and to really try and address precarity and bring invisibilization to the fore, bring voices that are not heard enough to the fore. So thank you, panel. Thank you, organizers. Thank you, audience. Let's keep the discussion going through Twitter, through sharing resources. We are a community together to support each other and amplify voices. And you will see that there is a follow-on session 6, around COVID. Thank you.
Bye-bye. They are kicking us off.
Thank you. Bye.
Thank you so much. Stay healthy.